atresia, a congenital discontinuation of the ileum, is the most frequent type of bowel atresia, is followed by the duodenal atresia. So, may I ask if nakasabot ka mo og unsa ang ileal atresia? Nasabot ra. So, I will explain. Ileal atresia, muna siya ang blockage sa atong ileum sa lower part of the small intestine. So next type of bowel atresia is duodenal atresia, a congenital anomaly in which the lumen of the duodenum does not exist, resulting in complete obstruction of the GI tract at the duodenum. So, sa duodenal atresia, blockage po siya sa duodenum. So, as you can see sa picture, nagtawaran na ninyo sa PPT, I provided a picture here. Naatiri ang healthy duodenum and the duodenum atresia. As you can see sa healthy duodenum, makita dyan mo nga na ay proper or normal passage of food paingon sa stomach. Gikan sa stomach. So, sa duodenum atresia, naa siya og na pinch off. So, dili na siya makaagi. So, reason nga ma-stuck ang pancreas. So, muna siya duodenum atresia. So, sa duodenal atresia, oral feeding should be withheld in infants with duodenal atresia. So, the third type of bowel atresia is the colonic atresia. It is a congenital failure of development of the distal rectum and anus, which may occur to variable extent. So, of course, blockage or closure sa colon. So, colonic atresia, a frequent complication is fistula, formation to the genitourinary system, which often can be repaired or surgically. Prognosis is excellent after surgical intervention for all three types of bowel atresia. So, yes, sa three types of bowel atresia, kailangan siya of prognosis after surgical intervention. So, the causes of the three types of bowel atresia, we have congenital discontinuation or malformation. So later on, I will tackle about the malformation. It is also one of the congenital and hereditary anomalies. So, failure of normal recanalization or vascular occlusion during fetal development. So, bowel atresia, we have abdominal distension, vomiting. Abdominal distension meaning kanang bloating or swollen sa atong tummy. Inability to pass stool or mechanat. Double bubble sign on X-ray, which is common sa duodenal atresia. So we have treatments. Surgical resection and anastomosis of the bowel segments, preoperative gastric decompression via NG tube. Imaging modality, plain radiograph. So, katong sa duodenal atresia, ang kuan ato is double bubble sign. So, we have plain radiograph for duodenal bulb distension. And then sa sonography, dilated stomach with fluid, absence of passage through duodenum. Prognosis is excellent after surgical intervention for all three types of bowel atresia as what I have said earlier. So next. Imperforate anus or anal agenesis. So, kabalo mo unsa ning meaning ani imperforate anus? Can you guys please read?
Imperforate anus or anal agenesis is a congenital disorder in which anal opening to the exterior is absent. A fistula may be present between the colon and the perineum of the urethra in boys or between the colon and the vagina in girls.
Alright, so imperforate anus, so ang natawan niyo sa picture, it's, there's no normal opening. So, example sa baby, it is a congenital condition where a baby does not have a normal opening of the anus. So, meaning, dili makagawas ang poop. So, nako'y picture dire na ipakita forms of imperforate anus frontal view. So, we have the normal anatomy. Kaning lalo muna siya ang anus, which is kanang naray kanang normal opening sa anus. And then sa anal opening, dito sa PCAS is the anal opening is missing or closed off. So, muna siya akong gingon nga dili makagawas ang poop. So next is hypertrophic pyloric stenosis. So hypertrophic pyloric stenosis is a congenital anomaly of the stomach in which the pyloric canal leading out of the stomach is greatly narrowed because of hypertrophy and hyperplasia of the pyloric sphincter. So, naadiri ang pylorus, gamay na po siya o passage. So, example, yung mga to ang pylorus is something door or gate. So, gate between the stomach and small intestine. So, in this case, the muscle of the pyloric is too thick. So, dili gyapon siya maagian. So the door cannot open well, and then if a baby tries to drink as milk, ma-stuck gyapon siya dito. So muna siya later on makita ang mga causes ani. Mabala na to ang unsay mga causes ani. So causes or congenital hypertrophy of the pyloric muscle. 2. Obstruction of gastric emptying. So, kinahanglan of gastric emptying kay it might affect the inside of our body. So, we're magsige o vomiting or etc. That is associated with maternal stress or family history. Signs and symptoms. So, it is projectile, so non-bilious vomiting in infants 2 to 6 weeks. So, kabalo mo unsay non-bilious. Okay, it is the blockage before the bile enters the intestine. So, it appears white or gray. And then treatments, surgical pyloromyotomy. So, pyloromyotomy, it is the incision of hypertrophied muscle. And then correction of dehydration before surgery, of course, it is important. So imaging modality is radiograph sa upper gastrointestinal or the upper GI. So shoulder, pit, and stream signs. And then sonography, mas preferred ani ang sonography sa pyloric stenosis. So, it shows thickened pyloric muscle, elongated canal. So, next is the malrotation. So, nabot na dyan ta sa malrotation. So, malrotation, it is the aberrations in the normal process of intestinal rotation in utero may result in the anomalous position of the small bowel and large bowel with abnormal fixations predisposing the patient to internal herniation and volvulus. So, supposedly, ang ato ang intestines are nicely coiled or kanang tightly coiled, but there are instances jud na if a baby is napag inside sa tummy sa mama, na instances na ang intestine is matwist, which is matwist or ma-misplace. So, meaning, naa siya malrotation. So, causes of malrotation, incomplete or abnormal rotation, fixation of the intestines during the fetal development, can lead to internal herniation or volvulus. So, signs and symptoms, bilious vomiting. So, when you say bilious, it is blockage after the stomach, appears yellow or yellow-green, and then abdominal distension, bloating, vomiting, symptoms of bowel obstruction or volvulus. So treatment, surgical, of course, surgical correction. We need a